In a lot of our breakout rooms, we've discussed pretty at length learning from each other and learning what other people are doing. So we don't necessarily have to reinvent the wheel if we're facing some of the same challenges in our regions. So this is a really good place to showcase that, to show what some of our iHeart cohorts are up to. So the way it'll work is we have 4 different groups that are presenting. Each one will have maybe 5 to 7 minutes to do their presentation, and then we want to afford them maybe 3 to 5 minutes afterwards for question and answer. So instead of me talking, I'm going to jump right into the first presentation. If the University of Washington School of Medicine group would like to come to the forefront, I will turn over the mic to them, and Izzy will go ahead and share those slides.
Yeah, thank you so much for having us. Hi, everyone. My name is Nijoni Sutter. I'm a citizen of the Navajo Nation, and I'm a first-year medical student at the University of Washington School of Medicine.
Hi, everyone. I'm Celeste Kohler. I am a first-year medical student at the University of Washington as well.
Next slide, please.
So Doctor for a Day is a program that started back in 2017 under the leadership of Dr. Estelle Williams and Nora Coronado. And the mission of Doctor for a Day is to encourage youth of color in the greater Seattle area to explore careers in healthcare. We do this through monthly events that involve suturing, physical exam skills, and ultrasound imaging that is predominantly led by medical students, but we also have residents and physician faculty attending as well, volunteering their time. We also often have physical therapists, occupational therapists, and people in other healthcare fields present so that we can teach students about the breadth within healthcare careers. At our monthly events, as I mentioned, we do suturing, physical exam, ultrasound, but we also have lots of opportunities for students to ask questions. We have multiple panels throughout the day so that students can talk to people who are already in healthcare professions about the barriers that they face and their path into these professions. We predominantly serve K through 12 students from backgrounds traditionally underrepresented in healthcare with an emphasis on middle and high school students. And we have multiple community partners in the King County area that help with our outreach, some of which are Gear Up, Rainier Scholars, Africa Town, Spin Girls, and the College Success Foundation. Next slide.
So for our Doctor for a Day programming, we recruit volunteer medical students and also physicians. So Doctor for a Day is student run by UW medical students. There is a leadership transition annually. And so first year medical students usually comprise the majority of our leadership positions. And for medical student recruitment for these Doctor for a Day events, we send out a sign-up sheet to medical students weeks in advance. And we found that all our volunteer slots are usually filled up every time. And it's a very popular event among medical students, along with residents and physicians. And residents have even told us that it's a great way to kind of reduce burnout and to be able to give back and be there for students. So as far as our physician recruitment, we recruit from UW School of Medicine departments like pediatrics, orthopedics, ophthalmology, nephrology, etc. And we also recruit from other departments like physical therapy, occupational therapy. And so they sign up for a month, like a year in advance, so they can reserve an event session. So we like to have themed monthly events. So some of these flyers on the right are flyers from our past events we've held. So we've had a cardiology and pulmonology workshop and an oncology workshop. We've also had a rehabilitation medicine and physical therapy workshop. So that was in conjunction with physical therapists and orthopedic surgeons. And then the attending physicians will recruit for residents, fellows within their departments.
I think something that is so unique about this program that we're able to do because we are a university affiliated with a large hospital system is not only do youth get the mentorship from medical students and attendings, but medical students also get to connect with physicians from underrepresented backgrounds and get that mentorship and technical skill building as well, which I think is really special. And we've also, like Najoni mentioned, we've heard from many physicians how useful it is to get to connect with their patient population in this intimate way, and also teach things about health prevention, and talk about issues like cardiovascular health to young people to do some preventative healthcare as well. Next slide. So this, as you can see here, we've had 29 Doctor for a Day events between 2017 and 2023, and this does not include our Zoom events that we had throughout the pandemic. And during these events, we've had 1,239 K through 12 students participate. As you can see here, we have a very disproportionately low percentage of participants who identify as American Indian or Alaska Native. And this has been a large gap in our outreach that we have been trying to address this year with our new leadership. And that's something that Najoni will speak on more at the end of the presentation. Next slide, please. And this is just to demonstrate that many of our students, because we do these community partnerships, are underrepresented in healthcare professions in multiple ways. Many of them are low income and do not have exposure to other people in their lives who have healthcare careers as well. Next slide, please. So from our data, we distribute pre and post participation surveys to all of our students. And what we have found is that after participating in our events, 59% of AIAN participants reported that they were more likely to attend college after the event. 59% reported they were more likely to pursue a career in a healthcare profession, and 82% said that they better understood what a doctor does. 78% said that they felt that becoming a healthcare professional was an achievable goal for them. And these numbers are at or above that of our students that identify differently. Next slide, please.
Yeah, so I came into the Doctor for a Day leadership this past year, and recognizing that disparity and the lack of Native students in the healthcare professions and in medicine, I thought it was really important that we have an event that prioritizes Native student attendance and participation. So for the first time in history, we're having a Doctor for a Day event specifically for tribal students. It's going to take place this upcoming May 18th. And so I created this flyer and we distributed this invitation widely to tribal schools, non-tribal schools, Indian educators, high school counselors, and Urban Native Education Alliance, among other community partners. And so at this event, we are going to have Native physicians and Native medical students present, helping lead stations. And so just kind of a general overview of the event. So as usual, we'll have our hands-on interactive rotations in the morning and afternoon. We're going to have a suturing station, an imaging with ultrasound probe station, splinting and casting, and also a CPR station. And at lunchtime is when we're going to have our medical student and physician panel conversation. And at the end, students are provided with a swag bag and also a folder with information about more educational opportunities that they can get involved in. And we are really excited to offer this event. I mean, it's the first time in Doctor for a Day history, but also just because we need so many more Native physicians and doctors and healthcare providers. And when I was in high school, I participated in similar events, and I really credit them to helping me get to where I am today. And they had a similar format of these hands-on rotations and also being able to interact with doctors in a non-medical setting. And that was really impactful in my journey to medicine. And so I'm really excited that we're able to have this. Next slide. And with that, AIHEART, thank you, everyone. We're so happy to be here. And feel free to spread the word about our event as well. We have a QR code and link on our flyer.
Wonderful. Thank you so much. And Stephanie, do we have time for a question or two now, or should we wait until the end perhaps so we can get all of our presentations in?
I think we have time for one or two for now.
Oh, there might be questions in the chat. Stephanie, could you check that for me while I get our next slideshow ready in the screen?
Will we be sharing the presentation? Yes, these will be available in the in that Google Drive, so you'll be able to see that. It looks like we have a question: does the college pay for lunch? And are the events on weekends or weekdays?
Yeah, thank you so much for this question. So the UW through the healthcare equity does have some grant funding. So we are able to provide lunch. They do pay for lunch and the swag bags. And then our programs are always held on a Saturday.
Awesome. Thank you. Any other questions? Feel free to come off mute and ask or put them in the chat if that's easier for you. Ah, there are two questions that seem pretty similar to one another. Have you thought about taking this program on the road to a reservation community or to other universities, things like that? Because it is super cool, super cool.
Yeah, absolutely. So we would like to, moving forward, have this as an annual event. And we would like to, as we continue to build those partnerships and relationships, we would like to go to reservation, go to their tribal meeting areas, and also go to tribal schools. So in Washington State, there's 29 federally recognized tribes. So there's plenty of opportunities to go straight into the community, go to the tribal school. And so we would love to do that in the future for sure.
One
Awesome.
thing that we've noticed is that we have had groups from rural parts of the state take buses into our campus, and we debate whether it's more useful for us to go to the communities and be in their space to make it more accessible. Or we've also heard from so many students that actually coming to the University of Washington, seeing the space, getting to see what the hospital looks like is a huge part of their understanding of what a healthcare career might look like in an urban setting. So there's some pros and cons to doing both, and maybe having two events that we can compare students' impressions would be really helpful.
And I think we have time for one more quick question. Have you given any thought to reaching below high school level, perhaps into the middle school realm?
Yeah, so all of our events for K through 12, however, we do emphasize particularly middle school and high school enrollment. So yeah, we would like to continue that emphasis. Some of our activities are definitely more geared for kind of the older students, the middle school and high school range. So at this upcoming Native Doctor for Day, we're going to have middle school, high school, and undergraduate students as well.
Fantastic. That's definitely a demographic that we at iHeart are looking to get our hands on a little more, try to catch them a little earlier. So thank you for your part in helping with that. And with that, thank you again for your presentation. We really appreciate that. And moving right along to make sure everybody gets all the time they need, we're moving into the Northwest Portland Area Indian Health Board and their We Are Native project.
Wonderful. Well, thank you to our host, iHeart, and accepting our proposal to be here to share the great work with you all. My name is Selena Ghost Dog. My pronouns are she and her, and I'm from the Navajo Nation. And I serve as the Adolescent Health co-director with a few of my colleagues. And I'd like to pass it over to Grazia here.
Hi, thanks for inviting us. My name is Grazia Cunningham. I use she, her pronouns. I work as a project manager on the Northwest NARCH project here at the Northwest Portland Area Indian Health Board.
Next slide, please. So the Northwest Portland Area Indian Health Board, we serve the 43 federally recognized tribes within Washington, Idaho, and Oregon. And we are one of 12 tribal epidemiology centers across Indian country. So you'll see our 4 primary goals there, a lot of context around health promotion, disease prevention, legislative policy analysis, training and technical assistance, and then surveillance and research. Next slide. So Dr. Melanie Goodman and team of researchers provided a 20-year update from the examination of racial and ethnic composition of public health students and faculty at School of Public Health. And you'll see here, I'd like to draw your attention to the yellow portion, which is highlighting Native Americans. You can see here the workforce disparity in public health shows the numbers of our Native communities are very low. So similar studies and resources to support some of the work that we're doing within undergraduate pathways of Native students and undergraduate concentration, including the younger generation, will really be pivotal into some of the things that we're going to share today. I definitely want to give a shout out to our evaluator at the Northwest Portland Area Indian Health Board for converting some of these tables into this presentation to have this visual slide deck show. And if you're interested in looking at that study, we'd be happy to share that later in the presentation. Next slide, please. So where are we going today? We believe in Native youth and young professionals, and we are here to support them in their journey. So we want to thank you for taking the time to join us this afternoon to learn about uplifting youth voices. In our presentation, we are really fun and unique in a certain way. So we'll be dropping links and we encourage you to check them out too. We encourage multitasking in a good way, in a healthy way. So we'll be sharing some information in the chat feed. Next slide, please. So through storytelling, observation, and traditional practices, they're vital to transmission of knowledge, which we're all familiar with from one generation to the next. So today, Native youth are using digital pathways, such as social media, websites, and online tools to help navigate these changes. So I dropped in the chat, We Are Native is a multimedia health resource for Native youth by Native youth. The site includes content on prevention around suicide, bullying, STIs, teen pregnancy, and drug and alcohol use. Their service also includes an interactive website, and in community engagement opportunities are Ask Your Relative anonymous Q&A service, a text message service that we'll highlight, and including a YouTube channel and social media accounts on Facebook, Instagram, Twitter, formerly known as Twitter, and now X, and then also TikTok. Next slide, please. Since its launch, the website has over more than 1 million page views, and our text message service has nearly 5,750 subscribers. And its health promotion messages that we disseminate has reached over more than 150,000 views per month across all social media channels. Next slide, please. So We Are Native bridges these traditional ways with innovative strategies to meet Native youth where they are. So as we just launched this Career Pathways resource page, which I dropped in the chat, the page inspires Native youth and young adults by sharing culturally relevant resources and opportunities to support their dreams and exploring pathways to become public health professionals. So in this pathway document, we have going all the way from middle school, high school, and into college. Next slide, please. So through our data at the health board and with our We Are Native adolescent health team, our data showed that Native youth and young adults were accessing technology at a higher rate than any other ethnicity. So why not reach them where they are, especially in the comfort of their own space and their own devices? We went ahead and thought it would be better to go through this pathway and reach them through health-based text message campaigns. Next slide, please. So in partnership with some of our local programming here, the Northwest Native American Excellence Center of Excellence at the Oregon Health and Science University has a plethora of resources to recruit, train, and retain Native health professionals in medical fields. So we teamed up with them, their We Are Healers Pathways program, and created this Inspire campaign. And I'll throw this wonderful chat resource in the chat. So this campaign here specifically spotlights Native health professionals and inspires Native youth and young adults to see themselves as future healers through the stories of Indigenous role models. The Inspire campaign is a wonderful campaign that also encourages youth to look at different pathways for different Indigenous cultural backgrounds. And we are working to encourage them to be public health and community protectors. If you want, you can text Inspire to 94449 to check out these resources. Next slide, please. We also, in the chat, I put the YouTube link, and you'll see those role model videos here. So the text message service from the previous slides shows a screenshot of what the student will receive or person who subscribes receives. But also within the text message campaign, you can get links to these videos that shows different types of stories from health professionals. Next slide, please. So in addition to our connection with the Northwest Native American Center of Excellence at OHSU and their wealth of information and resources to recruit, retain, and help Native students become health professionals, we teamed up with them and started creating a wonderful interactive pathway that helps them to get services. Next slide, please. And I just here want to share the organization We Are Healers. So this Text Healer campaign will connect students to their own personal coach, Christina. What she does is she shares resources, tips, and ideas to help them navigate to become a healer. So there's a pretty cool time frame where students can ask questions and the connection goes back and forth. So whether if it's scholarships, whether if it's wanting to hear more about Native professionals or wanting to hear more about other resources, it's a great way to get youth connected on a one-on-one approach. Because I know one of the things that we talked about yesterday too in the conference was about mentorship, and this is a great start leading there. Next slide, please. Our goal is to evaluate and reaffirm Native youth voices in STEM technology, or STEM, which is, of course, science, technology, engineering, and math, but connecting youth to Native professionals who work in the STEM field. So students are able to choose a career path that sounds interesting to them, and we'll receive weekly texts, tips, and inspiration that motivate them on that pathway. So I'll also drop that chat there. So if they want, and if you want, you can text STEM to 9449 to get subscribing to that platform. And next slide, please. And I'll hand it over to my colleague who will talk about another pathway that we have in store for you all. And then here is just another screenshot of some of the language into text message services content that comes through that interactive platform. Next slide, please.
So we're excited. We've got the Public Health Research Academy as our newest addition to the Northwest NARCH family of programs. And the Northwest NARCH stands for Northwest Native American Research Center for Health. And it's one of a number of NIH-sponsored NARCHs in the country. Our mission at Northwest NARCH is to improve tribal health by supporting the development of American Indian and Alaska Native health researchers who can bridge the gap between academic research and Native communities. Our academy is our year-long program for Native juniors and seniors in high school. It's the first time NARCH has had a high school program, and last year was our first year kickoff. The goal of the academy is to introduce Native youth to relatable public health topics, public health research methods, and the diverse pathways to a career in population health sciences. And we do that all through an Indigenous lens. The Academy has three main components. We've got a kickoff week in June in Portland, and this is a great time where everyone meets one another. Youth learn in classroom settings, they complete hands-on activities, they participate in cultural activities, and then they visit with Indigenous researchers at Oregon Health and Science University and Portland State University campuses, as well as our board staff. Once the June session is over, we gear up for our second component, which is the virtual learning. And that's really the longest component. It's from September to May. We have Indigenous scholars and researchers come and do monthly speaking engagements with our youth. And also, in addition to hearing from Indigenous scholars directly, we created a very youth-friendly handbook. And it explains some of the key concepts that they're learning about in a youth-friendly way. And we also maintain a robust online classroom in Canvas, which is our learning management system. And that's really been helpful to support that virtual learning component. Our final component in the Academy is a youth-led community-based research project, and they work with their site mentor to complete this. Next slide. This is just a visual that represents our journey with the youth. You know, we're all coming from different areas and experiences, but we're coming with our shared values like empowerment and equity and connection. And we're employing different methods to learn about public health and carry out research, as well as learning about different methods to share our stories and to share our data stories. Throughout the year, as I mentioned before, the youth meet with Indigenous researchers and scholars and hear about their pathways to public health and to research as well. And our ultimate goal, of course, is to spark that interest in a continuing pursuit of public health and a career in research. Next slide. Throughout our program, we are constantly evaluating what we're doing. We ask the youth and the mentors how things are going to see if we can better what we're doing. We work with an external evaluator, Allison Kelly and Associates. We conduct pre and post surveys of both youth and mentors. This is just our baseline survey from last cohort, and we had a nice representation of 3 states, Oregon, Washington, and Idaho. We had 10 youth and 5 tribes represented. From our baseline survey, we realized that we had a really wonderful opportunity to teach and learn about public health research methods, as they were not really very familiar with the methods. In June, we also have a great opportunity where our external evaluator comes and leads a working session with the youth, and they actually learn about creating in the process of evaluation. And we wrote up our process in the Indigenous Peoples Evaluation Association e-newsletter. Next slide. As I mentioned, we also want to hear from our wonderful site mentors, and they have shared with us that their youth are definitely much more knowledgeable about careers in public health and in research. And they're, for the most part, very much more prepared to advocate for themselves as a result of participating in this program. Other lessons we've learned from year one, I think Selena would agree that we are very encouraged about the future of Indigenous public health if we continue to reach the youth that we have been working with this year. Mentorship, of course, is key. The youth work with site mentors, they're community-based mentors to help them throughout the year, and they have access to our NARCH team and others at the board to help them through the process. And another important thing we've learned is that it's really important to offer multiple ways for youth to engage with the curriculum and to participate. So offering the live sessions and also recording those sessions if they can't come, having a youth-friendly handbook so they can work on their own. They come prepared to the sessions. We maintain a rich online classroom that we post all of our recordings and resources. We have a wonderful growing digital library of videos that we've created, so they get to hear from Indigenous researchers and scholars about their research, about their path to research. And of course, we have one-on-one meetings with our youth as well. Next slide.
Thank you, Grazia. Just to kind of wrap up the final presentation, we do have a wonderful resource too. Not only is it important to reach the youth, but youth aren't able to get to these opportunities without reaching out to the mentors, caring adults, educators, grandparents, and all those who are here on this call. So we have a wonderful resource for adults. Healthy Native Youth is a one-stop shop for educators and caring adults who work with Native youth. We have a wealth of information and resources that embraces cultural teachings, demonstrate effectiveness of some of the curricula we have available. Next slide. Lastly, if you're interested in any of the materials that we shared here, hard copies, we have a wonderful resource called nativehealthresource.com. You're more than welcome to order postcards, tip cards, if you want to put them in your waiting rooms, if you want to give it to students in your community, if you want to put a poster up, they're readily available and welcome to order. Next slide, please. This is our team, our adolescent health team. So I just want to thank you all for joining us this afternoon and giving us the time.
Thank you so much, Selena and Grazia. It was amazing. Awesome, awesome program. Really neat stuff. In the interest of time, we're having everybody put their questions in the chat, and they have both offered to answer them as we go along. So I want to go ahead and quickly turn it over to Northern Arizona University for their presentation about increasing cultural identity in STEM education.
Naomi, I think we can see your screen, but it's dark right now.
Hello, I got kicked off as soon as I tried to share.
Oh no. There we go. Okay. I think you're sharing now.
Let me get it into presentation mode. There's too many things right now open that I can't There we go. All right, can you see my slides?
Yes, looks
All
great.
right, awesome. Thank you. Hi, Skano. I'm Dr. Naomi Lee. I am from the Seneca Nation or Onondaga in Western New York. However, I live in Flagstaff, Arizona, and I am faculty at Northern Arizona University. But right now, I'm sitting in Vancouver because I'm at the Global Indigenous Leadership and Genomics Symposium. So I'm all over the countries right now. And so today I'm going to talk about the CARE program and what we've been doing over the last few years, and actually some of the outreach that we've been doing with other programs as well. And there is my Twitter handle, which we post on, as well as our lab website. And I'll post the website for the program in the chat afterwards. And so I've been actively involved with programs actually since I was a postdoc at the NIH, and I saw that NINDS posted um, or shared wanted to share their program. And so I was actually an NIH postdoc at the National Institute of Neurological Disorders and Stroke, and I worked with Rita Devine. And there we talked about how we could build the NIH summer programming to be more culturally inclusive, because when I started there was only about maybe 5 Native students in the summer, and they just really wanted some feedback. And so myself and others, two other faculty or two other postdocs were the Native faculty that helped guide this. And so we published this in 2018 about how we essentially refined the NIH summer program. But since then, I've been actively involved with different programs all across the nation. And I don't have hard numbers, but we estimate around 90% of students that have been involved from high school, undergrad, grad in these programs are still somewhere in the STEM field, whether they're a high school biology teacher back on their tribal nation or a faculty member or physicians. Um, and so more recently, we published a manuscript about cultural identity, and there we proposed an Indigenous science and internship model. And I'm going to talk about how we implement that in our current program, CARE, in a few slides. And so again, this is just briefly, this is the NIH website that Rita Devine, and so she works with Shanice Guest, and they do a lot of similar things to what we do because we talk back and forth. But again, this is on the NIH campus in Bethesda, Maryland. And so here's just a little bit more about the NIH summer internship. And again, I send many students 18 and older to this program. And so it really came about because when I was an NIH postdoc, had students that were coming to NIH, but a lot of times, whether they are high school or even undergrads, this was sometimes their first time either off the reservation or traveling and traveling by themselves. And so we realized that while some students flourished and they were totally fine and were able to be away from home and away from the reservation, other students really struggled. And so when I left NIH, we started these um, sort of these hub programs, right, where you would create programs, near the reservation that would prepare students so that when they are 18, they would then be able to go to the NIH and participate in some summer research. And so CARE itself, or the cultural and academic research experience, and again, we intentionally put culture first because we really try to emphasize that however you identify, that is one of the most important things, and it shouldn't be separate from your science identity. And so most of our students do identify as Native American. We have had students that are low income or other type of underrepresented groups. We have different funding sources now, but essentially all of them, whether it's the NIH, the Army Education Outreach Program, the American Chemical Society, or Flynn, they all have similar demographics that they're targeting. And so we've been running since 2019. And right now, our program offers 3 college credits for each student that participates. And then students can be nominated to attend the American Indian Science and Engineering Society in the fall after their summer internship. And so again, this comes from feedback from their research mentors. And then because of the pandemic, we actually created a virtual component. Our first year started off with 10 students that came to the NAU campus and did research. And then the pandemic happened. And so we had to switch to virtual. But as we started to come out of the pandemic, we kept that virtual component because we saw that it was so successful for reaching one, younger student. So we've had 14 and older in our program, and two, students that don't live in the Flagstaff area, because at the time we didn't actually have housing for students. And also because of the pandemic, we created an academic year program. So the fall primarily focuses on preparing students to go to the ACES National Conference. And then the spring, we hold monthly workshops. I'd love to have any of the other programs participate in the future. We just finished our last spring workshop. But essentially, we meet hybrids in person or online with students. We talk about career paths. We talk about all different types of STEM fields. And then we do a hands-on activity. So our virtual students, they're doing that hands-on activity at home. And then we have the students that are in person with us also doing the activity. And so because of the Flynn Foundation funding that we have, our program is drastically expanding this summer. So we have housing for 21 students, but we actually have 23 students that are going to be in our program. They're going to be in the honors dorm on the NAU campus. Faculty and mentors are also going to be receiving a stipend. We saw that as an incentive to recruit more faculty to take high school students, because working with under 18, they have their obstacles, and so that's really helped. And then students that complete our program receive automatic admittance into NAU's honors program. And so this summer or this fall, we have 7 incoming students. Our grant we wrote was 1 per year for 3 years. So we've already more than doubled our goal, and which is kind of a little stressful because now they might expect that moving forward. But going back to the model, right? And so this model was actually based on another reported one. However, we felt that, and if you're going to create culturally inclusive programs, there's some other things to consider, right? And so involvement in science is obviously important, but how can we involve students in science in a more culturally inclusive way, right? And so one is through summer research or spring with our students, but then sponsoring them to attend the ACES National Conference. That's been huge for our students. Another example is we host journal clubs where we have both Indigenous and non-Indigenous researchers come and talk about their research in the summer. And then we really feel like that community support is huge for our success. And so we have we have not only Indigenous research mentors like myself, we have speakers. We hold a book club where we talk about a book that's relevant to our students. We have a picnic where we invite family, mentors, staff as well. Our Native American Cultural Center is actively involved. It's a safe place for our students. We also have elders and wisdom keepers come and speak to the students, especially if we're doing outings and we're going to a sacred place. We want to make sure the students are aware. Again, I'm not from the Flagstaff area, so there's things that I don't even know. And then the closing ceremony is a very large joint closing ceremony. It continues to grow, where students showcase their research along with other students. We have lots of professional development activities that happen, and a keynote speaker. And shown in here is Dr. Mary Jo Andrichin, who is a native chemist at Northeastern. And so this year we have Dr. Cliff Poudry, who will be our keynote, which I'm pretty sure some of you know. And so when it comes to looking at cultural and science identity, we do a pre and post program survey with the students, and we actually published on the same survey when we looked at the NARI program, which I also saw was one of the ones, the NIH program and the University of New Mexico program. We did a survey with 18 and older, asking these same types of questions and reported on it. And that was actually that cultural studies, the reference I put at the bottom. And so we asked our high school students the same things. We just don't have IRB approval right now, so I can't actually show the data from it. But we see similar trends as what we see with our high school students and how they're seeing that their cultural connection to the STEM fields, there isn't a conflict between that. They're seeing themselves as scientists, right? And this is hopefully further increasing the likelihood that they'll actually continue in the STEM fields. And so what's next? So again, I've been working with different programs all around the country. I worked with Yakima Nation up in Washington with their program. I have worked with University of New Mexico as well as, like I said, the NIH. And then more recently, I've been working with Montana in their Young Medicine Movement program. And so what we actually did was develop a chemistry curriculum. This is the link to, you can access and learn about it more, about how to create cultural identity within chemistry, because I feel like students can see themselves as healthcare providers, as public health individuals, but as a chemist, I don't think students quite see how they can connect back to their community. And so that's what we really try to do in that curriculum. So we use it in both my program at CARE and also Young Medicine Movement, and also the Roots to Wings up in Yakima. And so Young Medicine Movement is directed by Dr. Teresa Brockie, who is at Johns Hopkins University School of Nursing. And I think I saw some others that are on this call that are involved with this program as well. And so the Young Medicine Movement is actually held at Ani Nakota College on Fort Belknap Reservation. And they're really focused on preparing students not only for STEM fields, but also nursing and public health. Again, because Dr. Brockie is also public or nursing. And so the structure is slightly different. They don't do such intense research like ours because Ani Nakota doesn't have the research capacity. And so they do monthly, weekly topics. And so career development, chemistry, biology, etc. And so I highlighted chemistry and biology because I go to Montana to teach chemistry and biology. And the plan is that I can't teach at every university or every program. And so I go up to try and train an individual that can take over. And so this summer will be more hands-off for me and more forefront for an individual that they identify to teach that. But they also attend conferences as well. So ACES, we usually have a big group together. They brought their students to NAU last summer for our closing ceremony. But again, I hosted the summer internship for Indigenous People in Genomics workshop at NAU. And so their students participated. And so this is just a picture of some of their students. And so there's a publication pending about the program. This program is also supported by a NARCH grant, an INDS contract, and I believe the tribes also participate into it. And so lastly, I wanted to talk about Palau. If you don't know what Palau is this little country out here in the Pacific Islands. So I also am an Army officer. I've been in the military for over 15 years. Right now I'm in civil affairs. And so I've been working with Palau. Primarily, I was recruited to help with their COVID-19 response with my biomedical background. And so there I've been working with their program called Sears Ed, which is down here. It's very similar to what the CARE program is. And Palau is very much like many of our tribal communities. They have their tribal leadership. So this is Bilung, who is their tribal queen. And then they have their federal, this is federal President Whip's up here, First Lady, some Ministry of Health, Ministry of Education, etc. And so I've been to Palau a few times now, where I'm helping to build up not only their biomedical capacity, but also working with their education. And so this fall, we created an MOU between Palau Community College and Northern Arizona University. And I actually took Dr. Jenny Ingram with me to Palau because we were invited to speak at the women's conference that is held every year. And there we just talked more about the cultural similarities and differences between indigenous populations, whether in the Pacific Islands or in the US. And this coming summer, I actually, when I was there the first time, I recruited a Palauan student to my lab, so Marinka. And so this summer, she has NIH step-up funding to return to Palau and to essentially set up what is done in my lab, but in the small little lab in Palau. And essentially it be starting a way to train students in Palau to then be ready to come hopefully to NAU or other universities with some research background. And of course, when you're in Palau, you have to go to the water. And so this is just one of the pictures of the water while I was there. Oh, I miss it. But again, I want to say thank you to everybody at NAU, the Young Medicine Movement, of course, my lab, my peer mentors, funding agencies, and then I'll put the link for the actual website to our program. Okay.
Thank you so much, Dr. Lee. We really appreciate that. I'm going to have anybody who has questions put that in the chat. We are running over time, but that's okay. We have wiggle room moving forward. Don't worry about that. We're going to make sure everybody gets their time to present. And now I'm going to go ahead and turn it over to our last presenter from the Center of American Indian and Minority Health at the University of Minnesota Medical School.
Thank you, Stephanie. So, can everyone hear me all right? Good.
Yes.
Perfect. So my name is Megan Golden. I'm the research manager for the center here at the medical school. And today I'm going to be talking about our program that's enhancing student academic aptitude through teaching of Indigenous research methodology. Next slide, please. So our program, Native Americans into Medicine, has been around for quite a while, well over 40 years. But it was in 2018 that we revamped the curriculum to narrow down the focus because we had a wide range of participants, which then means everyone's stretched a little thin and don't get quite the attention that they need or that's relevant for them. So narrowing it down to become more focused for sophomore and juniors in college. We do accept seniors or those who have recently graduated, or even those who may have been on a different path or have completed an AA degree, recognizing that a lot of community members and Indigenous students have kind of more of a windy academic road. And so we want to be available to them, but we do require that they have at least a year of college experience just to make sure that developmentally they're at least somewhat in the same category. So our primary aim is to increase the number of Indigenous scholars trained in Indigenous research methodologies and prepared to pursue graduate level work. This could be a master's, a PhD, medical school, dentistry, pharmacy, whatever it may be, broad spectrum healthcare. We're trying to prepare them to move on. And I do want to make the caveat that we use Indigenous research methodology as kind of the core tenets of this program. We model our curriculum off it. We base our weekly schedules on this, but also recognize we only have them for 7 weeks. So while we have lofty goals to teach them, we really want to lay the foundation, recognizing that you can't do everything in 7 weeks, but we try our best to at least provide them with the skills that they can go do this well and feel confident in themselves. This is also a 2-year cohort. So we'll do qualitative research 1 year and quantitative the next, or vice versa, depending on the project. And so we'd like to have them commit for 2 years towards this project. We go into the summer with a guided theme of what we want to do. Because it can get too broad and too big and too overwhelming. So we do narrow down an area, but we let our students guide where they want it to go. What are the specifics they want to pursue? What are the questions they want to ask? And in doing so, we also want to incorporate interdisciplinary medicine. So, and just health sciences and all. So we always try to bring in different professions to speak about their experiences, as well as bring in Indigenous scholars of a variety of backgrounds and experience in healthcare and in scholarship or academia and research. And one thing we do ask our Indigenous scholars to present on is their own path. How did that road look for them? What was their experiences? So really trying to highlight that there's this huge amounts of opportunities out there, and it doesn't always look the same as what we think of when we were graduating from high school or even in our first couple of years of college, that there's lots of opportunities out there and that their path can look different, and it doesn't always come in this nice, neat package that we're told it should look like. So we try to broaden that perspective. And also each week we do have sessions on student skills, like how to critically read and write, and how to use the library services. And then also how do you prepare your applications for graduate school? So personal essays, how to ask for letters of recommendations, how to take the MCAT or the GRE, working those in every week so that they have mentorship along with weekly book clubs and reading groups and cultural events we try to also bring in. So can we go to the next slide? So some of our big cultural components, Indigenous developed. So our director of the center, Dr. Mary Owen, really initiated this change and propelled this and developed this change from in the curriculum. As I mentioned, we do emphasize Indigenous methodologies with the research, talking about what that looks like, but also with the teaching. How do we build relationships and trying to incorporate Indigenous teaching methods within the 7 weeks as well. We have Indigenous staff and mentors. And the research we pick is always public health based. And we really try to make that relevant to community and relevant to students so that they have a vested interest in what they're doing as well. So it's not just a big obscure idea of like, well, why is this important? Why should I learn about this? How is this important to my community? We definitely work to narrow down those questions with the students' input, and so that we are working towards something that can benefit them and the community. We try to work in cultural activities through crafts and getting them access to ceremony if it's available at the time, and just trying to bring in as much. We can go on to the next. So the most important aspect of the program is relationships. And this is one of the big pieces we really emphasize in our Indigenous research methodologies. So the importance of relationships, the relationships with the students themselves, the relationships between the students and the staff and the faculty, the relationships between all of us, the NAM group and the community, and the data. That's an important piece too, that there's this working relationship with data and the way that we go about building community. Ideally, we'd have them in community beforehand and working with community to talk about what are you interested in? What can you do? What can we do for you? How can we do this together? And what kind of issues do you want to address? Again, we have them for 6 weeks. So that lands on the NAM staff to try to prepare ahead before and calling on some of our relationships ahead of time to how can we help the community? What are things that people are interested in? Going to our advisory boards, what are you interested in? And trying to get a feel of what can we feasibly do with students so that they learn, but also create a product that is built on relationship and relevant to community and the big holistic picture. Next piece. Some lessons learned. I think one of the biggest things that we learned, especially in the first year with the new curriculum, is that this can get really big really quick. Students are really interested and they want to ask questions, they want to do good work, and it can snowball from going from an undergraduate level foundational learning experience to, well, these are questions you could ask as a PhD student. So how to keep that pared down enough that they're learning how to do statistics, that they're learning how to do thematic analysis, that they're learning how ideally community and Indigenous research happens with community and relationship. But keeping the curriculum pared down is a struggle because we all get excited about it and they want to ask big questions. And then also how to disseminate that back. So another piece that we emphasize with the Indigenous research methodologies is that how are you disseminating it back to community? And we learned really early on that writing is a lot. It takes a lot of time. And while we want them to be writing throughout the course of the summer, we also recognize quickly that writing a paper is not necessarily something that we can turn around and then submit quickly. We did for one of our cohorts, and it took years to get it all compiled. So we do want them to leave with a tangible product that they can put on their CV. So we aim for poster sessions. And again, inviting the community, the medical school, the different organizations that we work with, different participants to come back and view those. And we'll send them out to the relevant partners as well that we've worked with. As I mentioned, we aim for a 2-year cohort. We're trying to touch on both qualitative and quantitative methods. Obviously, we recognize that life happens and students can't always come back the second year. We have been able to pull in new students to kind of keep a fairly robust of roughly 10 students each year, but it can be hard to balance those new relationships and help facilitate new bonding and cohort cohesion and build those relationships that we emphasize so much. So that is one thing that we are definitely mindful of as we're going forward. And and then finally, our recruitment timeline, we've tried to move that up closer and closer because other students are starting to ask in October, well, what do you have going on? I'm like, I haven't even made it to the end of fall semester with everything that's happening. Haven't thought even about summer yet, but students are starting to ask earlier and they're starting to make plans earlier. So being aware of that and adjusting our timeline as we go. And I think that was our last slide. Tried to make it quick for everyone.
Fantastic.
I think that was, I saw a couple quick questions popping up. So Courtney, 2-year cohort work with engaging students for 6 weeks. So we have them on campus for 6 weeks. They live here. We provide housing and we provide stipends for on campus. So they're on campus for those 7 weeks. Then throughout the year, in between the summers, we keep in contact. We'll try to host gatherings or definitely emailing them out, text messaging them constantly. That is one thing I should have put on lesson learned, is that they are overwhelmed with emails and getting them to respond to emails is difficult. A quick text message and I get a response, or I'll be like, hey, go check your email, and then I get the information I need back from them. So it's maintaining those relationships throughout the year. Some of our students are local to Minnesota, and so then they're invited to events that the center hosts, and that we're involved with their education already and check in with them regularly. But and then to follow it up afterwards, I touch base with them at least a couple times a semester going forward, emailing, texting. Dr. Owen and myself get asked regularly to write letters of recommendation and ask about pursuing ongoing education. So that's how we try to keep that 2-year cohort together and going for 7 weeks. And yes, for many years, NAM was 6 weeks, and we bumped it up last year, and so we're doing 7 weeks again this year. And then I saw another one about Indigenous research methods. Yes, so I think someone has like a talking circle. That's one thing that we use. The key with that we try to build on, because depending on your research question, different things will present themselves. So we know like photo voice is a great one to use with community. But we try to focus on building relationship and what community would need and how to disseminate information back. Ideally, it would be we'd build a project with the community's input. And so we try to talk those steps through. We try to get them access also to tools such as our ethics, the research ethics training out of Washington, which is fabulous, so, and geared towards Indigenous research ethics. So we get them access to that, and books like Research as Ceremony from Sean Wilson. That's a really great one that we use. It's really great for students because there's 7 chapters, so you can read a chapter a week, or you can do more condensed and shorter time frames. So utilizing those resources as well. Any other questions?
All right. I think if we are all done with questions, I'm sure, again, if you have any questions that we didn't get to or that you think of in a bit, you're more than welcome to use the chat to ask Megan, or we can perhaps help you follow up over email if that would be helpful too.